This is the PowerPoint that I think I gave you in class. Just make sure you have that available when you're taking notes. On this one, I'm going to do it a little bit different than the last one that I did. On this one, I'll just kind of give you pages as references so you can draw from your book. Book is the best place for this information. Okay, so you want to make sure that you review procedural guidelines on palpating systolic blood pressure in box 30-9. Review the clinical text on page 96. I think this is in the yellow pages is what I'm talking about. For the two-step method, electronic blood pressure measurement, you can find box 30-10. Remember, anytime you have a box that says 30, then that means it's in chapter 30. Review factors affecting vital signs of the older adults in box 30-13. Safety guidelines for nursing skills can be found on page 511. And see box 30-1 for ranges on vital signs. Review the skill on 30-5 for measuring blood pressure. And then the table 30-11 will give you common errors in blood pressure assessment. Make sure, okay, see box 30-4, that's for the advantages and disadvantages of select temperature measurement sites. Table 30-4 has factors influencing pulse rate. Box 30-7 has factors influencing character respirations. And then the table 30-6 gives you alterations in breathing pattern. Box 30-8 are factors affecting determination of pulse oxygen saturation. And then make sure you review the skill 30-1 on measuring body temperature. Page, yeah, I'm not sure exactly what page that is, but look up tympanic temperature as well. 30-2 on assessing radial and apical pulses. 30-3 assessing respirations, and 30-4 assessing oxygen saturation. Page, let's see, where are we? Patients on oxygen cannula, check behind the ears and the cheekbones for pressure from tubing. If so, you may need to apply padding in this area. If the patient is on BiPAP or CPAP machine, a cushion to areas around the mouth and nose to also help prevent breakdown. Okay, so review skill 12-2 on page 283 to 287. The most important information to obtain when planning care is the client's ability to perform self-care during ADLs. Skin care for immobilized patient access. Prevent and intervene if we see problems with this. The table 29-6 is on Centers for Disease Control. That table that the CDC puts out on isolation guidelines is important. I think it's on page 459. Also, make sure that you understand universal contact droplet airborne precaution, and then MRSA care, when and what to wear. Droplet, what diseases, what do you wear? C. diff, airborne precautions, in patients with hepatitis A. Review all of that, please. The stool for occult blood, that procedural guideline is box 47-4. Also look at box 47-13. That'll give you the focus on the older adult, that bowel retraining. Procedural guideline for digital removal of stool, box 47-10. Enemas, make sure you read, I forget what page it's on, but it's in your text. Make sure you read all about the enemas. Safety guidelines for nursing skills is on page 1170, and then skill 47-1 on administering and cleansing enema, skill 47-2 inserting and maintaining an NG tube for gastric decompression, and then look up the common causes of constipation. Make sure you look at, in your chapter 46, you look at that focus on older adults with urinary incontinence, positions for Foley insertion, allergies, review safety guidelines for nursing skills. Believe that's on page 1128. And then review your skills in that chapter 46 on collecting midstream urine specimen, indwelling catheter care, and closed catheter irrigation. Always think about patient safety when we're talking about restraints, and you can also review that skill 27-2, page 399 to 403. Review range of motion exercises. Use of TED stockings, when, why, make sure you understand that, and then how to apply and take them off. Look at the procedural guidelines on administering ear medication. I think that's on page 640. We just talked about in the other HESI review on the child under 3 and the adult. And make sure you're pressing and massaging that tragus after administration. And then skills related to IM injections, sub-Q injections, all of that, make sure that you review that. Even the teaching in box 32-14, skill 32-5, and then guidelines for IM injections 649 to 651. We're talking about pain management. Always go to those boxes and review those on the older adults, box 44-3, and then box 44-7 is possible sources for error in pain assessment. And then a lot of the common opioid side effects you want to know, that's in box 44-13. Also look at the skill of providing pain relief. This is fairly straightforward. Make sure that you look into items on this page. This one, make sure you review your text on 1074 for dysphagia and box 45-10 for different types of diets. Review your text 32-14, page 636 on procedural guidelines for giving medications through the G-tube. Sleep hygiene habits. Review those. You can find those in box 43-9 and then 43-5, 43-6 nursing assessment questions. Take a look at those, and box 43-8 on sleep promotion for the older adults. And then make sure you look at sleep hygiene in the hospitalized patient, which is 43-11, and then control of noise in the hospital is 43-12. Know what to delegate and not delegate as a nurse. Remember, the yellow pages will tell you that. Nursing responsibility, remember, only RNs can teach and assess and educate. Okay. Skill box 41-9 on procedural guidelines applying a nasal cannula or an oxygen mask, page 900 to 901. Review table 31-8 for skin color variations. Also, see table 41-1 on page 883 of the effects of aging on assessment findings of the cardiopulmonary system. And then go through and review sectioning skills 41-1 on pages 906 to 914. Remember to assess the secretions that you suction from your patient. Pulse deficit and effect on oxygen saturation. The decreased pulse equals decreased saturation. And then end of life, promoting comfort table, page 763, 37-3. End of life issues, see box 37-3 on cultural aspects of care. How do we communicate with the anxious patient, with the pediatric patient, patient with chronic disorders? Just make sure you go through those concepts and just go through and know your barriers to communication. Acknowledge and reflect on your client's feelings. Don't assume you know why someone's crying. Offer yourself, be present, or ask if the patient just wants to talk. Maybe you want to say this must be difficult, or it must be very frustrating to not be able to, blah, blah, blah. Tell me about blah, blah, blah. Communication evaluation, the teach back, you can find on page 110 through 111. Nursing process, please go through this, know this well from this slide. And Review your chapter on dealing with elderly patients and sexual activities. Review that box 35-1, page 718. Spirituality is still important regardless of a patient's religious beliefs. And then review text pages 356, box 26-3 on discharge information. Provide the patient written instructions, especially if patient is anxious, so they can know what to do at home and can look back over it, because if they're anxious, they're not going to hear everything that you say.